So I'm Marilyn Pierce-Belger. I'm a family nurse practitioner and a certified nurse midwife, and I'm the owner-manager of FASD Diagnostic Services. With the families we work with through the diagnostic process, I have to say the number one thing that astounds people is the fact that alcohol is worse than any of the illicit substances. And there's just not a safe time in pregnancy to be drinking. Alcohol at any point can have an impact. The other issue that I think we're running into is that providers may be reluctant or uncomfortable talking to women about their drinking, and they may not know what to say to them. So I think there's a couple different things that providers need to think about. The number one risk factor for having a child with an FASD is if you're sexually active and drinking and not using effective birth control. So what providers can do is do across-the-board screening in their practices. It's called screening and brief intervention, where they just routinely build a couple of questions into their practice about how their individual client might be using alcohol. Standardizing how we put that in a chart and in a risk list so that it then gets transmitted in the newborn nursery setting into the pediatric record. We've got to get our medical provider community really on board around being consistent about messaging about alcohol in pregnancy. We need to get the word out to the public that alcohol is worse than any of the other substances.